If you take blood pressure medicine and vitamin D every morning, I need you to stop what you are doing and listen carefully, because what I am about to share may explain why your blood pressure is still stubbornly high, why your sleep is getting worse, why your legs keep cramping in the middle of the night, and why you may not be getting the benefits from vitamin D that you thought you were. The surprising part is that the vitamin D itself may not be the problem. The blood pressure medication may not be the problem either. The real issue may be something missing in the middle, something so common, so inexpensive, and so overlooked that millions of older adults are struggling unnecessarily without ever knowing why. Before we continue, welcome to the channel. Here we focus on helping older adults understand their health in simple, practical language. If you find this kind of information helpful, please subscribe and turn on the bell icon. Every week, we discuss important health topics that can help you ask better questions, make better decisions, and have more productive conversations with your doctor. Now, let me ask you something. How many years have you been taking vitamin D? Was it 1 year, 5 years, maybe even 10 years or longer? Most people remember exactly how it started. A blood test showed low vitamin D. The doctor recommended a supplement. You trusted the advice because it made sense. You bought the bottle. You started taking it every morning. You followed the instructions carefully because you wanted stronger bones, better health, and maybe even better blood pressure control. But then something strange happened. Months passed. Years passed. Yet many of the problems you hoped would improve remained exactly the same. Your energy still fades too early in the day. Your sleep is still poor. Your blood pressure remains stuck. You wake up tired. You may even feel frustrated because you have done everything you were told to do, yet the results never matched the promises. If that sounds familiar, you are not alone. The first thing you need to understand is that taking vitamin D and actually using vitamin D are two very different things. Most people think swallowing a vitamin D capsule automatically means their body is benefiting from it. But the human body is much more complicated than that. Think of vitamin D like a brand new car sitting in a driveway. The car may be beautiful, it may have a full tank of fuel, it may be capable of taking you anywhere you want to go. But without the key, it never leaves the driveway. It has potential, but it cannot do its job. Vitamin D works in a very similar way. It requires support from other nutrients and processes inside the body before it can fully perform the jobs people expect it to perform. Without those supporting pieces, vitamin D may still appear on your blood tests. Your doctor may say your levels look fine, but inside your body, many of the benefits may never fully happen. This is where the story becomes very important for anyone taking blood pressure medication. Many older adults take medications called diuretics, commonly known as water pills. These medications are often prescribed to help control blood pressure and reduce excess fluid. For many people, they are important medications and should never be stopped without speaking to a doctor. But these medications can have an effect that few people talk about. As they help remove fluid from the body, they may also increase the loss of important minerals. At the same time, your body uses certain minerals to activate and support vitamin D. So now imagine what happens over months and years. Every day, you take your vitamin D. Every day, your body tries to process it. Every day, your medication may be reducing some of the very nutrients that help support that process. Little by little, the reserves become smaller. The body has to work harder. Yet nobody connects the dots because everyone is focused on the vitamin D number itself. Now let us talk about blood pressure. Most people think blood pressure is controlled entirely by medication. But blood pressure is influenced by far more than a pill. Your blood vessels are constantly expanding and tightening. Your nervous system is constantly sending signals. Your muscles are constantly responding to chemical messages throughout the body. When important minerals become depleted, these systems do not work as smoothly as they should. Imagine a garden hose. When the hose is relaxed, water flows easily. But when the hose tightens, pressure builds. Your blood vessels behave in a similar way. When they stay relaxed, blood moves more easily. When they become tighter, pressure rises. If the body is missing nutrients that help support healthy blood vessel relaxation, your blood pressure medication may have to work much harder to achieve the same result. This creates a situation many seniors know very well. The blood pressure improves slightly, but never reaches the target. The doctor sees the numbers and increases the dose. The patient follows instructions faithfully, yet the pressure still refuses to move the way everyone expected. Sometimes the hidden problem was never identified because nobody looked beyond the medication itself. Now let us talk about sleep, because this is where many older adults suddenly recognize themselves. Have you ever gone to bed exhausted, but found yourself staring at the ceiling? Have you ever felt sleepy, but unable to fully relax? Have you ever woken up multiple times throughout the night for no obvious reason? Many people assume poor sleep is simply part of aging, but poor sleep is often connected to much deeper issues. Your body does some of its most important repair work during deep sleep. Blood pressure naturally drops, stress hormones decrease, the nervous system calms down. The heart gets a chance to recover from the work it performed all day. But when deep sleep never arrives, the body misses out on those benefits. Blood pressure remains higher than it should throughout the night. The heart works harder. The brain never fully resets. You wake up feeling tired, even after spending 8 hours in bed. This is why sleep and blood pressure are so closely connected. Poor sleep can make blood pressure harder to control. High blood pressure can also interfere with sleep quality. The two problems often feed each other in a cycle that continues for years. Then there are the leg cramps. Millions of older adults know exactly what I am talking about. You are sleeping peacefully when suddenly a painful cramp grabs your calf muscle. The pain is sharp enough to wake you instantly. You sit up, you stretch your leg, you walk around the room hoping it will stop. Sometimes it happens several times a week. Some people experience it almost every night. Most assume it is simply aging, but muscles depend on proper mineral balance to contract and relax normally. When those systems are not functioning properly, muscles may tighten but struggle to release. The result is the painful nighttime cramping that so many seniors experience. And here's where the story becomes even more serious. A cramp does more than cause pain. It wakes you up. It forces you out of bed. It puts you on your feet in a dark room at 3 o'clock in the morning. At that moment, your blood pressure may be lower because of medication. Your balance may not be perfect. Your vision may be adjusted to darkness. This creates one of the highest risk moments of the day for an older adult. Falls are one of the leading causes of serious injury among seniors. A simple trip to the bathroom after a leg cramp can become a life-changing event. That is why understanding the chain of events matters. What seems like a small problem may have consequences much larger than people realize. Now, let us talk about the research, because this is where things become fascinating. For many years, researchers studied vitamin D and blood pressure. Some studies suggested benefits. Others showed little improvement. Eventually, many doctors concluded that vitamin D probably had very little impact on blood pressure control. That seemed like a reasonable conclusion at the time. Large studies failed to show consistent results. Case closed. But later researchers looked more carefully. Instead of asking whether vitamin D worked, they asked a different question. Why did vitamin D appear to work for some people, but not for others? That question changed everything. When researchers examined people who had adequate levels of certain supporting nutrients, they found something interesting. Vitamin D appeared to perform much better. Blood pressure outcomes improved. Overall results looked more promising. In contrast, people who lacked those supporting nutrients often showed very little benefit from vitamin D supplementation. Suddenly, the conflicting research began making sense. The problem was not necessarily vitamin D itself. The problem was that many people lacked one of the critical pieces required to help vitamin D function properly. That missing piece is magnesium. Magnesium is involved in hundreds of reactions throughout the body. It helps regulate muscle function, it supports nerve activity, it contributes to healthy sleep. it helps blood vessels relax, and it plays an important role in helping the body activate and use vitamin D. Think of magnesium as the key that starts the engine. Without the key, the engine never reaches its full potential. The car is still there, the fuel is still there, but the system cannot perform the way it was designed to perform. And there is one more important piece many people never hear about. Vitamin D helps the body absorb calcium. That is one of its most well-known jobs. But calcium needs direction. It needs to know where it belongs. This is where vitamin K2 becomes important. Vitamin K2 helps guide calcium toward bones and teeth, where it is needed most. When you look at the entire system, the picture becomes much clearer. Magnesium helps activate vitamin D. Vitamin D supports calcium absorption. Vitamin K2 helps direct calcium appropriately. Together, they work as a team. Now, I want to be very clear about something. Do not stop your blood pressure medication. Do not stop taking vitamin D because of this video. And do not begin taking supplements simply because you heard about them online. The purpose of this information is education. The purpose is to help you ask better questions. Talk to your doctor. Ask whether your magnesium levels may be relevant to your situation. Ask whether vitamin K2 is appropriate for your health needs. Ask whether your medications could be affecting important nutrient levels. Those conversations may be far more valuable than you realize. Many people spend years increasing medication doses while never investigating whether a missing nutritional piece is contributing to the problem. Sometimes the body simply needs more support to allow the entire system to function the way it was intended. The first thing many people notice when magnesium status improves is better sleep. Some notice fewer muscle cramps. Others feel more relaxed. Some report improvements in overall well-being. Every person is different, but the common theme is that the body functions best when all of its major systems are supported properly. So, if you have been taking vitamin D for years and wondering why you never experienced the benefits you expected, perhaps it is time for a different conversation. Perhaps the vitamin D was never the real problem. Perhaps the missing support system deserves attention. Sometimes the answer is not another medication. Sometimes the answer is understanding how the pieces fit together. Thank you so much for watching. If you found this information helpful, please subscribe, turn on the bell icon, and share this video with someone who takes vitamin D and blood pressure medication. You may help them discover something they have been missing for years. Disclaimer: this video is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Do not stop, start, or change any medication or supplement without consulting your physician or qualified healthcare provider. Always discuss your personal medical situation with your doctor before making health decisions.